All right, welcome to the lecture on infectious disease and infection control for the medical SLP. We are going to review all of the precautions that you may encounter when working in healthcare settings. All right, so we're going to start with one of the most basic. So this is universal precautions. So universal precautions are used with every patient that we encounter. So whether or not there's a known risk for infection or a confirmed infection, we are always going to follow these guidelines. So a thorough hand washing or antimicrobial agent before and after patient contact. So usually before and after you enter their room. Disposable gloves for any bodily contact. Disposable gowns if clothing is likely to become soiled. Eye covering and masks if any expectorant, blood, or bodily fluids are likely. So for us, what that would usually mean is if you're working on feeding or swallowing with a patient and or anything with a trach. So those would be the times that you want to think about how you might be exposed to bodily fluids or expectorant. All disposable intact syringes and sharp instruments go into the designated sharps container. Again, doesn't usually apply to us, but you should know that information. Disposable items that have been exposed to infectious fluids go to a red biohazard bag. So that would be maybe if you're in an outpatient setting and you're using an otoscope to look in someone's ear, that tip cover would go into a biohazard bag. All right, contact precautions are the next precautions that we'll talk about. So contact precautions are used for patients with known or suspected infections or evidence of syndromes that are increased risk for contact transmission. So these are infectious diseases that are transmitted by person to person with contact. So maybe like skin to skin contact, let's say. All right, so if someone is on contact precautions, they will be in a single patient room on acute care. For people that are living in long-term care facilities, so maybe like a nursing home, they make those decisions on a case-by-case basis. So in that case, maybe there would be 2 people in the room. They kind of decide usually always with the guidelines from a physician. In the outpatient setting, if someone's on contact precautions, you would isolate that patient as soon as possible. So they wouldn't be like lingering out in the waiting room. They would go back to, their care room as soon as possible. If you're working with someone on contact precautions, you're going to don gloves and a gown every time you enter their room or their cubicle. Okay, you're going to remove and observe hand hygiene before you leave the patient care environment. So you would take off your gown, take off your gloves, wash your hands with soap and water. You are going to limit patient transport. So again, that doesn't always apply to us, but maybe thinking about it if you're in the acute care setting and you're trying to decide between a modified barium swallow and a FEES. This might be someone who might be, depending on other factors, but maybe a FEES would be more appropriate so you're not moving them around the hospital. That's not always the case, but something to consider. If they are transported from their room, the nurse or transport will cover and contain the colonized areas. They would remove their PPE prior to transport, then put on clean PPE to handle the patient once they get to their destination, like radiology or wherever it is they're going. If you're working with someone on contact precautions, you're going to use disposable equipment as much as possible and follow proper cleaning and disinfecting procedures for any reusable equipment. So you'll see wipes around the hospital and in healthcare facilities. There are regular cleaning wipes, and there's also wipes that have bleach or other disinfectants. So typically for someone on contact precautions, they need to be using the wipes that have the bleach in them. And for those wipes, you also want to make sure you're using gloves because it can harm your skin. So again, your actual facility can walk you through the specific guidelines, but if you do bring a FEES into the room, you would completely wipe that, all of the equipment down before you left the room. Any contaminated equipment, so like a scope, would have to be in a plastic bag. And then we use disposable equipment as much as possible. So this would be someone, maybe you are working on like cognition with them. Maybe instead of bringing an iPad in to do things, you're going to write things down on like a piece of paper. So you can just kind of toss it when you're done. Frequent cleaning and disinfecting of the rooms and all frequently touched surfaces. So usually The cleaning crew, like at facilities, will come in and they'll make sure to use all of the proper cleaning equipment, and they'll usually keep that room even more clean than others. All right, someone on droplet precautions. So this is when someone has an infectious disease that's known to be transmitted by respiratory droplets. This group of patients would also be in single patient rooms in acute care. And same thing, decisions case by case when people are residing in a long-term care facility. And same thing, you're going to isolate them as soon as possible if they come to outpatient. You will use PPE, so that personal protective equipment, and wear a mask upon entry to the room. There aren't specific CDC recommendations for eye protection, but if you are going to be in close contact, so again, maybe like feeding, swallowing, trach, speaking valves, any of those sessions, you will probably want to keep eye protection on. And then with this group of patients too, they're going to limit patient transport. So they're going to try to keep, procedures in the room. If they do have to leave their room, that's okay, but the patient would wear a mask. Airborne precautions are another type of precaution that you'll run into, and this is when people have an infectious disease that can be transmitted the airborne route. So if someone is in an acute hospital or even long-term care facilities, they are put in, they're called air rooms. So it's an airborne infection isolation room. So these rooms, they'll have like a little dial outside the door, but there's direct exhaust of air that goes to the outside, and the air pressure in that room is monitored daily. So with a visual indicator, so that's usually like the dial that you see. You'll see like a little thing, almost it looks like a thermostat maybe, right outside the door, and their door is kept closed all the time just to maintain that air pressure. In an outpatient setting, the patient would have a surgical mask on, and after they leave, that room has to stay empty for 1 hour after they leave. And then you would go in, or whoever would go in, and complete the proper cleaning procedures. If there is ever a large outbreak of some sort of airborne infectious disease, the patients can be cohorted into the same area, just for ease of, again, it's like you don't have a lot of those air rooms, so people might have to cohort together. Immunocompromised healthcare workers are usually restricted from entering these rooms. And this is a room that you will wear a fit-tested N95 or a high-level respirator. So if you get a job at a healthcare facility, you will likely, or you should be, tested for an N95 because there's different sizes, and you want to make sure it has a complete seal because you don't want any air leaking into your mask. So some of you may have already done that at your internships, and we can talk about in class what the test looks like. So you should always have a fit tested N95. If you don't have one, they need to get you one, or another therapist should maybe go in that room before you do. And then same thing kind of as with the others, you're going to try to limit their transport as much as you can. And if they do have to leave their room, you would cover any skin lesions, and the patient would be wearing a surgical mask. All right, so some other things to consider. Hand washing, I can't emphasize it enough, but it has been demonstrated to be the single most important procedure for preventing nosocomial or facility-acquired infections. So really, really, really be using that hand sanitizer when you're going from room to room. It's going to keep you safe, it's going to keep other employees safe, and it's going to keep the patient safe. It's huge. So hand sanitizer and washing your hands, like soap and water, washing your hands is very important. Everyone and everything in a facility is considered to be an infectious risk. So with that said, you want to really kind of watch where you set your materials and your equipment. So, if you have like a big binder, or maybe you're carrying around a couple books, find a spot, find a cubby, find a counter or something that you can set it on instead of setting your stuff on the floor of the hospital, for example. And then, picking that up from the floor, and then, you're moving along to the next patient room, and we're working with people that are compromised. So we really need to be extra cautious about where we're putting stuff, where we're, everything, where we're picking stuff up from. And kind of along that line is once your gloves are on, so let's say you're in a room and you're about to, put a speaking valve on or something like that. So you have your gloves on when you're in there, and then, the nurse comes over and asks you something, and you end up throwing something in the garbage can, and then you kind of walk over because they want their window open. So then you open up their window, and you've done all that with your gloves on. Well, now before you go back and you touch their trach, maybe it's time for new gloves. Just kind of watch what you're touching. Just be a little bit more aware of that. You want to avoid eating or drinking in patient care areas. That reduces the chance of germ spreading and infectious disease. Keeping your fingernails short is usually encouraged or sometimes even required at healthcare facilities. Most have policies in place for no acrylic nails, and mostly just it's again for the infection risk component of that, of things getting under the nails and things like that. You will always wear closed-toed shoes when you're working in a healthcare setting. And then the CDC obviously has they're usually the guide for hospital precautions. So use their website is always up to date. So your hospital will have, or healthcare facility, they'll have a department, or they'll have infectious disease doctors or people that are giving you these guidelines. But if you ever have your own questions, you can always go to the CDC to find your answers. One other thing to consider that I don't have on the slide is just thinking of yourself. So if you are immunocompromised, if you are pregnant, if you have any other condition that might make you more susceptible to picking up an infection, or if you did get an infection would be more harmful to you, those are all good things to keep in mind and talk about with your team, with your managers, just to keep yourself safe first and foremost. All right, we will do a little bit more on all of this in class with an activity, but thanks for listening to this part. All right, bye.